Okay, welcome back. Good morning to all of my dear viewers. So, in today's session, we are going to discuss a very important topics of community medicine, and the name of topic is disaster cycles. So, in disaster cycles, there are five steps included. What are these five steps? One, the first step is obviously the impact of the disaster. The second is after the impact, the immediate steps taken by us are the response. So in response, in response it includes both rescue and recovery. So how we respond after the impact? I mean, how we go for the recovery and what rescue? So for recovery and rescue, we follow our triage rules. And what is this triage rules? According to this triage rule, we can divide all the patients into the four categories. One of the most severe patients are kept under the red categories who need immediate treatment within 6 hours. The second category is the yellow categories in which we kept relatively a stable patient who need treatment within 6 to 12 hours. And in third categories, that is a green categories for the stable and the ambulatory, I mean a movable patient. And the fourth categories is the black categories in which almost fully stable patients are kept. So the first, I mean the second steps is the rescue and recovery. So after the rescue and recovery, the next steps is rehabilitation. So what is the meaning of this rehabilitation? In rehabilitation means we basically now we make the people self-dependent by giving jobs. So which types of jobs given in such situation? We basically for the helping of people and the distribution of money. So for these jobs, whatever the money earn, they utilize this money for the reconstruction of their houses. So the third step is the reconstruction of their houses. After reconstruction, the next step is mitigation. Mitigation means it is no, we prepare itself such like that we reduce the impact of disaster. So after the mitigation, the fifth steps is the preparedness. I mean we are fully prepared for the next disasters. So these all are the five different steps of the disaster cycle. Now we go for the reading section. So the disaster, this is the first step, that is disaster impacts. After disaster impact, the immediate steps taken by us is the response, I mean rescue and reliefs by triage treatments. So what is this triage treatment? We classify the people on the basis of severity into the four categories. The red who given the first priority because they are the most severe patients and they need saving surgery and treatment within the 6 hours. The yellow category is a relatively stable patient. They need treatment within 6 to 12 hours. And the green, they are the stable and the ambulatory patient. And the black, which is the fully stable patient. Okay, the second step is the rehabilitation. So in rehabilitation, we making people self-dependent by giving job to the peoples, like helping the people's distribution of the medicine. So they get money and utilize it for the reconstruction of their houses. So this is the third steps, that is a reconstruction. And after reconstruction, the fourth steps is the mitigation, where we try to decrease the impact of disasters. And after mitigation, the fifth step is the preparedness. One more important note is that during the disaster condition, no vaccination is given for the general population, but we give vaccination to the healthcare workers. Basically during the disaster, we give three medicine: one is the tetanus, typhoid, and chlorella. So these three medicine, tetanus, typhoid, and chlorella, which are given only for the health worker, not for the general medicine, and not for general. I mean not for general population. Okay, so that's all.